Hi, I'm Dr. Stryker from Lincoln Crossings Dental Care. I'm one of a few COIS-trained dentists in the greater Pittsburgh area. And what that means is we help people with a mouthful of challenges completely rebuild their mouths through cosmetic dentistry, implants, or sometimes even a combination of both. And what I want to talk about today is a question I get all the time. We do a lot of implants, we do a lot of full mouth rebuilds, and people always ask me, especially as they're like going through the implant process, they're like, Doc, what is this teeth in a day thing? How come they always say I can get my implants done in one day? So I want to explain what that is. So teeth in a day is a very real thing. It's not made up, it's not voodoo. We do it here all the time, but it's a very specific situation we can do that in. And so the situation that teeth in a day can be done in is when someone is having all their upper and or all their lower teeth removed all at one time, and we are replacing everything with dental implants in a all-on-X or all-on-4 style of teeth. And if you don't know what those terms mean, Google them. There's tons of examples to show you exactly what that means. All on X, all on 4. And honestly what that means is all of the teeth on 4 implants or all on the teeth on X number of implants. That could be 4, it could be 6, it could be 8. The number has changed and gone back and forth throughout the years as to how many you really need, how many you can get in. And all these are just nuances as to what we do. Everything we do in our office is very customizable, meaning sometimes it's 4, sometimes it's 6, rarely it's 8, but usually from 4 to 6 implants is our typical protocol. But if we can get 4 to 6 implants in during a surgery, which we always do, we can attach a temporary set of acrylic teeth. It's a U-shaped bridge, so it just looks like almost a horseshoe-shaped set of teeth, and that will get bolted into those implants that same day. So you walk in with your existing teeth that are in bad shape, need to be removed. So during the surgery, we remove the teeth, we place the implants, and then we attach a set of temporary teeth to those implants that same day. So that is what teeth in a day is called. It's a great way to go. I mean, when it works out, they wake up, they have a new smile that they love. They can eat almost anything. I mean, there are precautions and restrictions we give people, and the more they follow them, the better they're going to heal and quicker they're going to heal. But it can be a very safe way to go. There's a lot of science behind this now. We know if we hit certain parameters and certain numbers during the surgery with our implants and how strong they are and how well they go in, we know it's a very safe thing to do in a healthy person. So teeth in a day, it's a real thing. We do it a lot here. Maybe I can do a video explaining exactly what the process looks like. The teeth part, I'll show you an example of what it is, not the surgery part. And I hope that answers any confusion as to what that is. Teeth in a day does not apply to single implants. It does not apply to 2 or 3 implants, singles here and there or doubles here and there. It only applies if we're doing a full set of teeth, a full set of implants, and a whole arch. So I hope that helps. Something we do a lot here and it works really well.